Now, Bruce will tell you that sometimes it could take one session, sometimes 10 sessions to find the right conditions to bring about this transformational change. But the change does happen, within the session. Yeah. So if you happen to have the right conditions, and we won't go into what memory reconsolidation, what those conditions are. That's a whole nother thing.
Well, just check out the mag. We've got lots of references to that.
We've got lots of references to it. But when you do, if you do have those conditions in the first session, then yes, that transformational change can happen.
Yeah. There is a thing very interesting to me. Some months ago, no, probably the last year I saw a client with OCD, obsessive compulsive disorder. And he came and he say, I have these thoughts, I see to kill my wife, I had these pictures, I stabbed my wife, and this is terrible. I had this problem 10 years ago, and then I solved it, and now it's here again. Mm-hmm. I ask, you have this problem 10 years ago. What you did 10 years ago? Oh, I took pills. I took pills for 6 months and they worked. So I say, yeah. So damn, it seems a good solution. And they say, yeah, it's true, but I don't want to take pills this time. Okay, so what can you do? Actually, Flavio, 1 year ago, I read a book, and this book has basically a paradoxical intervention homework. And I did that, and it works for 1 year. So I say, so you're telling me that for a year it works, so you can do it again? You say, yes, I can do that. So we can just do it in a more systematic way. Okay, and I teach him the more systematic way. And then we say goodbye. I say, it's enough for you? Do you need a session? I say, no, I can walk with my own leg. What I'm trying to say is that we don't need always to solve client problems. I think this is another important aspect of the mindset. To solve a problem is one of the things that we can do in psychotherapy. Sometimes we just need to give the clients the strategies, or to give him our ears to hear him, to listen to him, or we need to answer to a very acute, a very emergency problem situation, So I think that another problem, if we want to use this word, is that sometimes we think, but it's not impossible. It's not possible to solve a problem in one session. Yeah, maybe it's true, but it's not what you need to do every time.
Yes, it's possible to bring the client. I was actually just thinking of a couple of films. I can't remember the titles, but where they had psychiatrists in the film, and the client would be sort of saying, I think I'm okay now. I think I can manage. And I can't remember which one it was, but it was a bit of a thing. And the psychiatrist just looked at him and said, no. You are not cured yet.
Well, if you want to know more about the science of psychotherapy, come across to our website, thescienceofpsychotherapy.com, and our podcast of the same name, and learn more about the science of you.